Okay, Dr. Langdon, how long have you been doing liposuction?
I have been doing liposuction since 1995, so it's been about 21 years now. And it has evolved over the years. We do things a little bit differently now than we did back then.
Okay. And tell me how it's changed over the years.
Some of the parts of the liposuction are really the same. The type of local anesthetic that we use. One thing that I have found is that the concentration of the key ingredient of the anesthetic, which is lidocaine, we have been able to reduce that. So most commonly today we use half the concentration that we used, back then. And that's a big advantage because it allows us to treat larger areas. We do have to limit the amount of anesthetic to avoid side effects, but we're able to do relatively large amounts as far as the body areas because of that. The other big change, I think, has been the use of energy sources, especially laser, to enhance contraction in certain areas. So we now use, we actually have 3 separate lasers that are all for laser-assisted liposuction. And they have different qualities, different characteristics. We don't always need laser, but certain parts of the body can really benefit from the extra contraction that you get. And those areas include the upper arms, the front area of the thigh. In people that have a lot of loose skin or stretch marks in the lower abdomen, it can be very helpful to have the extra contraction that the laser will give us.
Okay. Do patients need to lose weight before they undergo liposuction?
They don't always have to lose weight. People have pretty much a fixed number of fat cells, and when they gain weight, the existing fat cells expand. When they lose weight, the fat cells are still there, they just are getting smaller. And we can do liposuction in either case. If the fat cells are larger, that's not a problem, we're still able to get rid of them. One thing about weight, we remove a certain amount of fat, say when we do liposuction of the abdomen, and we might remove often up to 3 liters of fat, sometimes even more. And the fat itself, if you were to weigh it, it would weigh approximately 2 pounds per liter. So it's important. I always tell patients after a liposuction to make sure that they lose the equivalent amount of weight. So if we took off 3 liters, I would say make sure you're 6 pounds lighter, in the future. And on top of that, if they lose additional weight, there's a great synergy between the additional weight loss and the improvement that they've gotten from the liposuction. So the people who lose additional weight will have the very best results. There is a kind of a myth that when you do liposuction, sometimes the fat will reappear in other areas. And that actually does not happen as long as the person loses weight equivalent to the fat that was removed. If they did not lose weight, let's say 6 months to a year later, they weighed exactly the same, they would still look better where they had the liposuction just because those fat cells are gone for good, but they would have gained fat volume in other areas. So assuming they have the same muscle mass, that they're physically in the same condition, studies have actually been done to address this and with MRIs, and they have found that after liposuction of the abdomen, that if somebody did have a steady weight status afterwards, that they actually would have gained some of the weight in the visceral fat, so that the fat cells below the fascia actually enlarge. And they still look better because of the external improvement from the liposuction, but they would not look as good as they would otherwise because they still have literally the same amount of fat. So it's important to lose at least some weight after any liposuction.
Okay.